Hi, I'm Sarah Rodriguez. I'm a second year PhD student in nursing science, and I would like to introduce you to my research exploring the construct of negative expectancy violation in NICU moms. So, when we think about the transition to parenthood, though we may expect this transition to generate a degree of stress, we also ultimately anticipate a rebalancing and reestablishment of the family system following infant birth. But what happens when this transition occurs within the technical and medical environment of a typical neonatal intensive care unit, or NICU? The literature tells us that infant NICU admission results in increased stress and adjustment demands on the family system, and that mothers, in particular, are at increased risk for experiencing psychological distress, including greater anxiety, stress, depression, and PTSD. High levels of maternal distress can negatively affect overall family functioning, mother-infant bonding, and lead to adverse infant and childhood developmental outcomes. And so, as clinicians and researchers, we want to be able to identify those moms who are at increased risk for developing psychological distress. The problem is no standard protocols or guidelines exist for screening NICU moms. And because individual maternal and infant characteristics can vary widely in this population, predicting maternal risk remains challenging. However, although individual predictive factors do vary, we propose there exists a commonality, a construct which offers broad predictive potential in this population, and yet which remains unexplored in the NICU literature to date. This construct is negative expectancy violation. So basically, when we have an expectation, when that meets with reality, it can be positively exceeded, it can be met, or it can be negatively violated. So basically, negative expectancy violation refers to a negative discrepancy between expected and actualized experiences. In the NICU setting, we see that moms may be tasked with a sudden need to revise their prenatal expectations of the infant and parenting to match the postpartum reality, and this can result in increased stress, reorganizational, and adjustment demands. We propose that negative expectancy violation can also illuminate some key findings and current inconsistencies in the NICU literature. For example, the most frequently reported stressor among NICU mothers is perceived loss of the parental role. While this can be understood as a negative violation of prenatal expectation regarding the parental role. Similarly, a surprising yet repeated finding in the literature has been that severity of infant medical risk or neonatal illness have actually not been found to be predictive of maternal distress in this population. We propose this can also be understood through negative expectancy violation. That is, while studies have tended to focus on objective factors, such as number of hospital days or infant medical acuity, it may well be that maternal distress is more correlated with the degree to which these objective factors violate maternal expectations rather than the inherent objective severity of these factors in themselves. And therefore, in mothers with known high-risk pregnancies, who are more likely to have medically acute infants, they are also typically more likely to be counseled regarding the likelihood of NICU admission. They may be oriented prenatally to the NICU or perhaps be able to meet with the NICU medical staff and ask questions before infant birth. If resulting prenatal expectations more reasonably match postpartum outcomes, this may explain why infant medical risk or neonatal illness have not been found to be predictive of maternal distress in this population. In conclusion, we hypothesize that negative expectancy violation is positively correlated with maternal distress, and we predict that moms with more rigidly held prenatal expectations, which are then negatively violated, will experience higher levels of distress compared to moms whose prenatal expectations are either more flexible or more closely match the postpartum NICU reality. And in light of the current COVID-19 pandemic, when considering how the added effect of this novel stressor may factor into maternal distress, We similarly hypothesize that maternal distress will be correlated with the degree of negative expectancy violation and therefore stress the importance of adequate prepartum pandemic education, particularly clarifying any revised hospital pandemic policies which limit the number of visitors or limit partnered parents' ability to visit their infant together. Thank you for your time. If you have any questions or comments, please email me. I would love to hear from you. Thank you.